Hi, my name is Lorne Brown. I'm a doctor of Chinese medicine. We're here at Acubalance Wellness Center, and today we're going to talk about endometriosis. We're going to talk a little bit more about endometriosis and how is low-level laser therapy treating it, or part of the treatment. And the reason we're doing this recording actually is I have with me Roop from Endo in the 604, and you have this amazing support group that's online, and you've been having lots of questions with me about this, and then we decided let's share these questions and answers with your group.
That's right, yeah.
All right. And so I'm going to hand it over to Roop because I want to know what kind of questions she has, and we'll go from there.
All right. So like Lorne said, my name is Roop. I started Endo in the 604 last year as part of raising awareness for endometriosis in the Lower Mainland. I've been coming to Acubalance for a couple of years now, but as of recently, we started laser therapy, probably in the last about 7 months it's been.
I think so, yeah.
And I was having great results. So we wanted to share that with you guys, along with what Acubalance has to offer, because it's not just laser, it's not just needles. I actually learned a lot of stuff about Chinese medicine through Acubalance and through everybody here. So I'm hoping we can talk a little bit more about that today and get a little bit more into laser and talking what laser can do for endo.
Definitely. And part of the discussions we've had and why we think it's important to share this information with you as well is it's a multidisciplinary approach. We get these questions about, can laser help me with my endometriosis? And the short answer I would say is yes, but that's not the approach. We have to look for those underlying causes, and then it's multifaceted. There's dietary therapy,
Of course, yeah.
There's nutritional supplements, there's herbal, there's stress reduction, there's acupuncture, laser, and probably many more things. So our goal is, I guess what I'm saying is laser's not a magic bullet. You can't come have one treatment and then you're all better. You can't go back to eating processed foods that are causing inflammation in the body.
Right.
You can't if you're not dealing with the stress that's leading to inflammation in your body. If you're not living a good life, then it's going to be hard to get great results. So it's not that kind of magic bullet. So I wanted to make sure we manage those expectations. People think you come in and we wave our laser over you and it's magically done.
Yeah.
No, first we got to find the underlying cause. And then it's a holistic approach. It really is. And I think that's been your experience of kind of getting the control back in your life by improving different areas in your life.
And doing a lot more things consistently. It's like, if you're going to work out and be fit, it doesn't happen by going to the gym once or eating right once.
Right.
You got to do those things consistently, eat right, take care of yourself. Self-care is huge in this as well. So managing all those aspects to get a hold of endo, basically, like you said, it's not just one treatment or, one thing that's going to cure it. It takes a multiple approach to many things in a person's life to manage the endo.
Definitely. And so our approach when people come, and we want to know kind of the underlying cause, like what's going on here, because from the Western perspective, we're not even clear what's happening with endometriosis, like why. There's many theories out there.
Right.
And then Chinese medicine has their understanding. So I come from the Chinese medicine approach, and we have functional medicine at the clinic as well. So that's kind of the lens that I like to look at it. And so, some of the things I see clinically and how I believe that's affecting it is I think a lot of the chemicals in the environment, the endocrine disruptors, I think these are probably part of the issues that we're seeing in some women with the endometriosis. From a Chinese medicine perspective, there's this theory from the West that says that you kind of get this retrograde menstruation. The blood kind of goes through the tubes and into the pelvic area, and then these implants go in. Well, this happens in many women, but not all women end up with endometriosis. So when I put on my Chinese medicine hat, I'm like, what's happening with these women that get the retrograde menstruation that end up with endometriosis? So when I think of the systems, the organ systems that are involved for absorption in the immune system, if they're off, then blood won't be absorbed properly and you develop implants or adhesions or scarring. And so from the Chinese medicine perspective, we know there's going to be some retrograde menstruation, but we want to make sure the organ systems, or what we put in the West, the immune system, is functioning properly. Therefore, this blood is absorbed and does not end up becoming adhesions or scar tissue. So we look for those things in Chinese medicine. And then our approach, we look at the symptoms. So we don't treat endometriosis, actually. We treat a pattern. You make up a picture. Each symptom is like a little piece of the puzzle to us. And if you just give me a Western diagnosis, I have endometriosis, it's not enough really to put together a treatment plan. But as you show and share all your signs and symptoms, each little symptom is a piece of the puzzle. And once I get enough of those pieces, even if I don't have all the pieces yet, I can tell what the picture is going to be. And we treat that picture, what the West would call syndromes, Chinese medicine calls TCM differential diagnosis. And that's kind of what we treat. And so for endometriosis, some of the common symptoms are spotting before your period, painful menstruation, infertility. So that each one is a little different of how we treat. And then you could be cold or you could be hot. You could be thin, you could be overweight. You could have loose stools or diarrhea, or you could be constipated.
That's right.
Insomnia, sleep really well. Your pain can be dull ache. It could be sharp and stabbing. You could have like this cold pain is twisting versus different types of pain and where it is in your cycle. So not everybody would get the same treatment. If you have a Western diagnosis of endometriosis and you see somebody like myself, a Chinese medicine doctor, your acupuncture and herbal prescription, dietary therapy may be different than a friend that has endometriosis because it becomes very individualized.
That's right.
We don't treat the disease, we treat the individual. And so our approach would be dietary therapy, big part of it. Why? Well, actually, I'll back it up. Everything we're looking at, and when you want to think the Western way, we want to help regulate your inflammation. So there's a lot of inflammatory things going on when somebody has endometriosis. So how can we help calm this inflammation? So diet.
Diet's huge,
Supplements. Supplements I like, because I know you asked me what are supplements. You know, there's a few we can use, but the two I really like are the omega-3 fatty acids, and I like N-acetylcysteine, NAC.
Yes, NAC.
NAC is really good at regulating inflammation. There's some data coming out on how it helps with inflammatory conditions like endometriosis. Some belief that it may even regulate some of the genes that impact inflammatory markers like prostaglandins and stuff.
Right.
So I like NAC because it really helps the liver do its detoxification and helps with overall inflammation. So I use it in a lot of things in our practice.
Well, I take both of those.
You take those. So you're on track there. So, and then diet, you want an inflammatory diet, and we can talk about that after. There's herbal, everybody's herbal formula will be different. There is not a Chinese herbal medicine for endometriosis because as I mentioned before, everybody is individualized, so they don't all present the same, even though they have the same diagnosis. And I thought today, because it's kind of new, a lot of people said, I'm doing diet, I'm doing herbal, I'm doing acupuncture. What's this low-level laser therapy?
Yes.
So the new scientific term, actually, they call it photobiomodulation, PBM. It's also well known in the scientific community as low-level laser therapy. Some people call it cold laser, laser acupuncture. It's not like the laser you go to your medical doctor where they're going to remove something or do eye surgery. It won't cut and burn you with low-level laser therapy, the lasers that we're using. So that's something important to share because some people are listening to this could be like a physician thinking, oh my God, you're going to use a laser. It's not the laser that they're going to do laparoscopic surgery with and cauterize and get rid of your endometrial scarring or adhesion. It's not that kind of laser.
It's an external laser, basically.
It's external laser, and you know the locations we use it. We do explain the mechanism why, and then kind of the placements, and we can talk about treatments and stuff that you've been going through and what people can expect. And so it's basically helping manage the symptoms of endometriosis, and it does this by it increases blood flow. So it's really good at increasing blood flow. It's been shown to help regulate some of the autonomic nervous system and immune system. And the most exciting part for people with pelvic pain, dysmenorrhea, or endometriosis is it helps regulate inflammation. So some of those inflammatory markers like the pro-prostaglandins, the cytokines, all these inflammatories that lead to pain, there's lots of research showing how it regulates that. And then it's been shown to help soften scar tissue and adhesions. How I came across the laser in our practice, because you know we do a lot. We're well known for reproductive health and women's health in general. And what really got me excited is I was actually reading the book, The Brain's Way of Healing by Norman Doidge. And when I was reading Norman Doidge's book, The Brain's Way of Healing Itself, there's a chapter 4 there where he's talking about one of these clients where they had brain issues because it was about the brain injuries. But this woman also had a lot of pain and endometriosis, lower abdominal pain. And Fred Kahn is a vascular surgeon that now does just laser work. And in the book, he talks about how he has treated anecdotally. He shares how he's treated many women that no longer even needed the surgery. They had such good resolution. So I went to Toronto and shadowed Dr. Khan for a day, talked to their group there, and then he was really kind to share his endometriosis laser protocol with me. And then we started using it in our practice. And again, patients are sharing how they're seeing some benefit from the laser with the pain. Now, we don't have anybody, I think, that just does the laser. There's a combination. So everybody's, we go over diet. Whether people follow our instructions, I don't know, but we go over diet. We'll make supplement recommendations. Often they'll be Chinese herbal, not always, but often.
Those ones people might not be following.
Yeah, the herbal. Herbal doesn't taste very good.
The herbs are not that great, but actually they do work. I have to say they made a huge difference. The supplements and the herbs, along with everything else, like you feel the difference after you take them for a while, and then you don't take them.
That's good to know. And I'll say the form that we use powder concentrate. So kind of like a pharmaceutical grade powder concentrate. They get tested out of Taiwan and then in the States and then in Canada. So they're not, you don't have to decoct them, meaning cook up the raw herbs in your kitchen, which a lot of people like to know about. However, they still taste as bad. They just don't smell up your house and take an hour to cook. Yeah. But when you add hot water and drink it, you're still not going to be very happy.
There's no way around it, basically.
But the good news is, I always say it takes 3 to 4 days for your palate to adjust, and then you're usually okay with it. You don't still love it, but you're like, I can.
And I think a lot of people with endo can agree, having endo and following the dietary restrictions, you have to have an acquired palate. Everything is an acquired taste. Gluten-free bread. I mean, you would never eat that back in the day, but now that you have to, you get used to it and you start to kind of like it, so things change as you're trying to change your diet, and things you didn't like start tasting acceptable, I guess.
You adjust. We're human beings. We adapt.
Exactly.
And so if somebody came to me with endometriosis, we like to look for some underlying causes. Where's their imbalances? Where do they may have heavy metal toxicity? The exposure to their job. We like to encourage diet and supplements that will encourage liver detoxification to support the body that way. A colleague of mine used to say, healthy liver, happy menstrual cycle, right? So we really want to help with the liver. We would do acupuncture. Now, one of your questions you asked me was, can you do laser and not have acupuncture? Definitely. You could do just laser and do no diet, no supplements, no herbs, no acupuncture. But I recommend a multi approach because you're going to get a better outcome most likely. However, if you have that really big fear of needles, then sure, just do the laser. I think everybody, regardless if you're using acupuncture, herbs, supplements, or laser, everybody who has the diagnosis of endometriosis and experiencing pain probably give a real good go at the diet for a minimum of 3 months, and exercise and lifestyle like stress reduction, meditation. The stress reduction, the diet, and the exercise will help with the inflammation. And I think we see clinically a lot of women just can improve from that. So that should always be part of your program. And then you can choose to add acupuncture, and you can choose to add laser therapy, herbs, and supplements. Dosaging matters. It's interesting because we're well known for fertility and women's health, so we treat a lot of women diagnosed with endometriosis and infertility, or just endometriosis. And often they'll say, hey, those acupuncture points are similar to what my acupuncturist, because they came from another acupuncturist, was doing, but they weren't seeing maybe the same results. I think dosage is a big issue, as in a lot of people will come just once a week or every 2 weeks or every 3 weeks, especially at the beginning. And it's just probably the dosaging. The point combination is probably correct, but you're not doing it enough. And it's just like exercising. If you're getting into shape, you're training for a marathon, training once a week versus 3 times a week, you're going to get different results. Studying for an exam once a week, 3 times a week. So at the beginning, what we find is seeing people 3 times a week is ideal at the beginning, but a minimum twice a week for a couple of weeks. It kind of kickstarts the body. We're kind of giving the body a chance because we really understand and believe that the body has this innate ability to heal. And when you start to experience poor health, what we're noticing or what's happening is your body has lost its ability to self-regulate. This homeostasis, this equilibrium has come out of balance. And so our goal is to get you into balance. So having a series of treatments close together, usually kickstarts the body, and then you can start to spread out those treatments, and then you notice if the symptoms are coming back or not, and if they're not, you can continue spacing them out, and if they are, then you hold it until they don't continue to come back. And that's kind of where I think when I talk to colleagues and I see patients, the treatment's pretty good, just the dosage and how often they're seeing them. So at the beginning, you do want to get in there regularly. And, I'm going to give an example just for back pain, because we've seen this quite a bit. Twice a week, 3 times a week, 3 times a week for 2 weeks is 6 visits, right? Versus 6 visits weekly. Same amount of visits, going to cost you the same amount of money, but the people that get 3 visits a week for 2 weeks, in 2 weeks, they're going to have a substantial improvement in their back pain, clinically what we've seen, than if they just came once a week. Mm-hmm. So that's why it's getting those treatments close together at the beginning. You see a lot. And when you look at the research on laser, sometimes when it doesn't look so good, when you talk to the people that really understand laser, the experts I get to interview and talk to, is either the laser's underdosed or overdosed, the power,
right,
or it's like they're coming once a week or every 2 weeks. Yeah. And, if you do a study on Prozac, take it once a week versus every day, the clinicians would say, well, that's not fair. This drug may work, but it's not going to work if you're spacing it out that much. Mm-hmm. So that's probably one of the biggest tips. If you're seeing somebody acupuncture doing laser, and you're going once a week, you're not seeing that benefit, they may have the right approach, you're just not seeing them enough at the beginning.
And I think that's with any therapy. I mean, you should be attending the recommended times that, your practitioner is telling you, because that's what's going to give you optimal results, right? Same as like physio, they don't want you coming in every day, but they do want you coming in 2-3 times a week, to work on yourself and then doing stuff on your own as well to, make that progress basically. Right. So it's the same sort of thing with acupuncture and laser. I find I've done the 3 times a week. We did that for a month and it worked really well. So it's not as if I was wasting my time. And as I say now, I come here once to twice a week, because I'm going through a little bit hard time, as you guys know. So it's kind of keeping that up and doing things myself as well for diet, like you said, doing the herbs, the supplements. I'm always like, I'm 80% on that, but getting that down to 100 is a goal, right? And being consistent, that's when you're going to start to see the results.
And consistency is the key, and you don't need to be perfect. That's why we give you so many things to do, knowing you're not going to do it all.
Right, and everything small steps, right? Yeah. You got to try things out, but definitely with the laser and acupuncture, I mean, doing that 3 times a week and working on your diet on the side, I think those are 2 essentials you have to do in order for that to make a difference. Yeah.
And with the laser, because it's excellent at regulating inflammation, increasing blood flow, it's been shown to soften scar tissue adhesions. So when we use it, people go, where does it go? What do you do with it? So there's a technique, Shiro out of Japan, and we do a modification of that. And that's doing treatments around the stellate ganglion to affect the autonomic nervous system and blood flow everywhere. So that's common. And then there'll be points on the lower abdomen, so over the uterus. So we do points there, maybe around the ovary, especially if we know you have some scar tissue implants around that area. And then we like to do stuff from the nerve roots coming out of the sacrum that are going to innervate the uterus. Around the pudendal nerve as well. So all externally on the skin. And so we're treating basically your front and your back. It doesn't hurt, the laser, so you don't actually feel it. If it didn't beep, you wouldn't know it was on, right?
That's right.
And you get to relax, and it's causing an effect on the body. And so one of the questions you asked me is will it stop the progression of the disease, I think was one of the questions. Mm-hmm. And I have to say, we don't really know. I don't think it's been studied. So I'll kind of think this through with you guys. One is we're not just doing the laser, and so our goal here is to help. Our goal is to help stop the progression of this disease. But a lot of the things that we do is managing the pain. And just like when you take NSAIDs and opioids, it's not stopping the progression. It is just managing the pain. Right. These are approaches that don't have the side effects. However, if a lot of the inflammation is coming from your diet or chemical exposure or the emotional, and the emotional is, your sexual abuse, verbal abuse, alcoholic family, like things that are really causing stress in your life, which causes inflammation too, we're hoping you're addressing those, and we can help you address those so the source of this inflammation gets to go down a bit, right? Right. And then I wonder what's going on is if it's affecting the progressing of the disease. I'm curious if that's what it's doing. When we think about our approaches, we're treating pain associated with endometriosis. I don't think it's treating endometriosis. And from a Western perspective, we really don't know what causes endometriosis, right? And so that's why it's a hard question to answer. And in time, we'll see with our patients, right? Does it come back? Now, here's the trick, though. If you come in for treatment and you get good results, but you go back to those old eating habits of really processed food, tons of sugar and alcohol and microwaving your plastic stuff, and you get another abusive relationship, then I was expected to come back, because that's probably the contribution to this pain, right, this inflammation. So really, I think, again, when I think of Chinese medicine and how we treat things at Acubalance, is we do our best to look for those underlying causes and treat those causes rather than treating the symptoms. But so much of it's around your lifestyle, your diet, your sleep, your exercise. All that is a huge component of your health and vitality. And then everything we do here, the laser, the acupuncture, the herbal, they act as catalysts. They act as like support. So I don't consider them as so much as fixing you as supporting the body and giving it that chance, to help it find its ability to self-regulate. And then as you're doing all the things that you can do that probably put you into this dis-ease body, right? It's not genetic, but more of a dis-ease body where you're out of balance, and you make these good changes, then we can start to pull away all these treatment modalities and your body can maintain it. Now, some people just, whatever's going on, they may need maintenance for the rest of your life, but a lot of people don't, and that's the beautiful part. But the alternative is NSAIDs and opioids, which aren't a good long-term solution anyhow.
There's so many side effects. I mean, with this, you don't have a treatment. You can have a treatment, and then go home. You're not going to have side effects if you don't have the treatment the next day versus taking opioids. Those have harmful effects. Right. So I'm glad you're mentioning all that we can, take all that away, because, as you know, I was taking Advil consistently, and we were just talking yesterday. I actually am not taking Advil. I took it once this entire week, whereas I used to take it 6 times a day. So that's a huge change. That's a huge change, and we're not for or against anything. Like in our clinic, you take what you have to, basically. You take what you have to, and then because some people, I can't take Advil, I can't take naproxen. Our goal is that you don't need to take it as much, but sometimes you're going to need it. You may need it, but if you're taking it, 6 times a day? 6 times a day, yeah. Versus not even once a day, right? Yeah. Not even, so that's a good improvement, but we're not suggesting you never take it. Our goal is that you don't need to take it because of the side effects of it. We want you not to be able to have to take it. However, sometimes you got to go to work and you got the pain, so you take that. Just to kind of help you, right? However, hopefully through diet, lifestyle supplements, that you'll get to a place where you don't need to take it. And that's our goals, because those drugs, although they're effective at managing the pain, there are side effects that we don't want you to have. So that's why we want you to get off it. Look, if there was 0 side effects to them, then keep taking it, right? Yeah. But we know there's side effects. Exactly. That's why it doesn't have long-term proactive for your health. So in the laser, the treatments, you're in and out within the hour. It's around the abdomen and the lower back area, a little bit over the stellate ganglion. And if people are open to acupuncture, then we combine acupuncture with it. The herbal is very individualized. Dietary, you want lots of fiber in your diet. You want to avoid sugar that leads to inflammation. Recommend you get off coffee and alcohol that have inflammatory. If you have food sensitivities, just your mood and how you feel in your body when you eat certain things, even though it's considered healthy for most people, read your body. And if you'll kind of know how you feel, then stay off those foods. A lot of people have comment, you'll see it on Dr. Google, and people share that when they go off gluten, they find that they feel better. So some people get an inflammatory reaction to gluten. There's other discussion, is it the gluten? Because when they eat gluten in Europe, they don't have that reaction, but they have it in Canada, United States, they do. That's right. Yeah, I heard the same thing. Yeah, and I've heard that it's how they process it here. I think some of the chemicals they use to clean it are quite toxic, and that maybe we're reacting to the processing, the chemicals they use, even though they wash it off, there's probably some residue. I don't know. That's not something I've been able to, I've looked into enough, but what I can share with you is we have seen patients when they go off gluten, sugar, even some of the dairy for a while, they notice the inflammation goes down in the body, they feel less pain, and just overall their mood is better, their skin changes, they feel it in their body, right? And so
Go off the foods that you know can be inflammatory. Go off foods that you know that you just don't feel right on. And then more green leafy vegetables, more fiber. Meat also can have that inflammatory effect. So we're not recommending that you go vegan or be vegetarian. That's not what we're suggesting. We're suggesting more of a plant-based diet, and just maybe your quantity of meat could be less. You'll benefit, and quality. So grass-fed beef, if you're going to have that kind of animal protein.
Mm-hmm. Avoiding beef, I think, in general, meat, of having fish or turkey or chicken might be a better alternative if you do want to eat meat, but red meat has been known to cause triggers with endometriosis.
So know your triggers.
But it is, like you said, individual. I mean, for me personally, I can't eat Brussels sprouts or broccoli or quinoa. Those things upset my stomach and cause bloating. So even though it's healthy, it doesn't sit well. So like you said, it's very individualized, and I think you have to look at the person, see what's going on, what sits well with you, and like you said, give it some time. That's the most important thing. Doing 2 days of a diet is not going to give you the results versus, if you do it for a couple of weeks, at least you're going to start to see some results at that point.
And you're not expected to be perfect. At the beginning, we want you to. I got into this medicine. Your listeners may not know this, but I used to be a chartered accountant. I'm still a CPA, a chartered accountant, but I don't practice, obviously. This is what I do. Yeah. But I got into it because I had a lot of digestive issues. And back in the day when I was doing all the healing, this is back in the 90s, if I was eating well for 3 weeks and then I went off my diet, I would flare right up again. So it took a while, over a year to really get strong. And now, I'm not as thin as I used to be because I can eat everything and I don't react. But if I eat that way, the foods that I used to react to, if I eat them for a period of time, or a long period of time, my symptoms will come back.
Yes.
So you will so I will share with you that right now, for many of you, if you're eating clean for 3 weeks and you just have that one offending food, highly likely you'll react to it. It's going to take a while. But eventually, again, the body finds its innate ability to heal. It starts to self-regulate, and it can tolerate that.
That's right.
It will be able to tolerate it. However, you can never go back and eat that way for the rest of your life on a regular basis, or your symptoms will come back. But now you can enjoy that pizza. But I wouldn't be trying that in the first 3 to 6 months. You're really going to have to be diligent. The reason what I'm sharing with you, though, is the good news is there is a silver lining at the end of this, that you can tolerate other stuff. Most people can when they get to this good state of balance and the inflammation is really under control.
Yeah, I've noticed that difference too with some things. If I'm in a really good state and I have something, it doesn't affect me. I'm like, whoa, that's that well, but that's why it is, right? Because the rest of the time I'm trying to stick to an anti-inflammatory diet so I can get to that point where I can have a cheat day,
Exactly. There's a wedding coming up or a birthday, so you're going to, enjoy yourself. Or if some people know they're going to not have a good day, but just enjoy that cake that night, and you may suffer tomorrow, but enjoy it while you're in it. But most people can get to a place where they can have some fun days during the week. It just takes several months to get there. And the N-acetylcysteine, we have this at Acubalance, so you can come here for that. Vitamin D I like as well, but NAC and the omega-3s I really like. Ideally, it'd be great to get it from fish, and we still recommend fish in your diet. The concern is, though, there's so much mercury and chemicals in our fish, which isn't good for people diagnosed with endometriosis. So getting a good fish oil brand where they have good processing, they clean the oil properly and put back the natural vitamins and not put back synthetics. So you kind of get what you pay for. So be careful when you're shopping that you get a good brand. So the fish oils and the N-acetylcysteine at a really good dosage. You'll find stuff on Dr. Google about NAC and endometriosis. So I recommend those supplements. The diet on Acubalance website, we have a fertility diet, and there's also a endometriosis section, so you can look at that. And in our practice, you don't have to be trying to get pregnant to get here. We get that sometimes.
I thought that too when I was first here. Yeah.
I had one of my patients contacted us and said she had infertility endometriosis, and she was successful in our clinic, and her sister had it. And she asked if we could recommend an acupuncture clinic for her sister. And then she said, look, I would totally send her to you, but she doesn't want to get pregnant. So people think that's all we do here. We're famously known for fertility, but we treat women's health and pain in general. And so you don't have to be trying or wanting to get pregnant to see us. And so if you just came in with endometriosis, we would do our best. We would treat the pain associated with endometriosis, the spotting associated with your endometriosis as well. And again, we look a little bit more for those underlying causes, what can be contributing to your inflammation. So we like to do the conventional testing. Plus, we do a lot more functional medicine testing, because looking at the spectrum of health, we have over here disease, and then over here is vitality. And the conventional testing, which we're all familiar with, is about making sure you don't need to go to the hospital. You know, death is not a risk here. But as we go along this line of health from dis-ease, and now you're not in disease, your lab tests often look normal, but you're like, but I got pain, and I got bloating, and I got headaches. So this is normal, but normal doesn't mean healthy. Normal means absence of disease. Thinking the functional medicine, Chinese medicine, naturopathy, as you go along to vitality, you go along this line, and we do other testing because we're looking for these subtle imbalances where they don't necessarily show up as a disease, but they show up where your body's not functioning. You wake up and you're tired and you can't get out of bed, or you're getting these regular headaches, or you have all these aches in your body. That's not vitality. That's not where you need to go to a hospital, but it's not how we want to live. And so that's why we do these other testing. The other thing to ask is people always wonder, treatment, how long? So we talked at the beginning how it's important to get those treatments close together. And I really recommend 3 a week at the beginning, but no less than 2 a week, just at the beginning to really kickstart the body. You know, when I was a lot younger than I am today, one of my roommates, he's a physician now, and he was going through med school while I was going through Chinese medicine school. And later on in life, we were meeting up, and I was talking about a patient that I see, and this patient's been my patient for over 2 years. And he said, well, that shows me that your stuff doesn't work, because why would she still be seeing you? It's 2 years later. And I said, oh, I get why you would think that. So I'll share with you the same response I gave to him. I said, at the beginning they came during this line, they came because they needed to see me. They were really struggling and suffering in their life. And they tried the conventional side, right? So that's people that come to us, often they've tried that. And there's a lot of people that are just open to what we do, so they come right away to this as well. So they come because they need it. And then they start to have less pain or no pain. Their cycles get regulated. Their headaches go away. Their body temperature warms up. They start to sleep. They lose 10 or 15 pounds. And now they feel great. And then the thought occurs to them, hey, I feel great. I actually want to maintain this. And maybe I can feel a little bit better. So they go from needing to wanting. So they're not coming twice a week anymore. They're coming in once a month or every 2 to 3 months for maintenance, right? Because now they want to maintain it. And for those people that know sports, like the Michael Jordan, you know, he was the best basketball player in the world. He was the MVP, many championships. He still showed up in practice. He didn't say, hey, I've arrived. I'm the best. I don't think I need to practice anymore. He practiced because could he maintain it? And maybe he can get it a little bit better. And so what I share with you and what I share with my physician friends is they're thinking of the disease model versus absence of disease. Oh, you're no longer at threat of dying. You're good. You don't need to see me anymore. And I shared that patients come to us needing, like they're really struggling, like they're like desperate often, right? I don't know if that's the right word, but you're struggling, you're suffering, they're motivated. That's the word I want to use. It's not that they're desperate. They're like, I need to get well. I am motivated. And then they feel really good. And then it becomes wanting to, because you don't have to be sick to see an acupuncturist or a naturopath. Mm-hmm. It's about vitality. So one paradigm is about disease, and health is absent of disease. And then our paradigm is about vitality. And that's why you will see somebody, an acupuncturist or a naturopath, for the rest of your life maybe, because you want to maintain that health and say, can you make it a little bit higher? Just the intensity is much less once you're in that good place. You don't need to go as often.
That's right, yeah.
That makes sense, right?
That makes sense, yeah. And I've been here for a couple of years, and not because it doesn't work. Yeah. It's because it has been working, but also, like you said, it involves a lot of my part, too, to keep it going. So I need to keep coming back to kind of get those treatments when I'm doing stuff for myself on the side as well, to make sure, you know, you can get better and then get better than better, basically. 100%.
Mm-hmm. And, you know, we have some patients where they come in and, you know, 2 to 3 months, and they're good. And then they come in every once in a while just for maintenance. And then we have some people where they just, their constitution, they just are going to need support for for the rest of their life or for a long time. And so it's a hard question, how long, because everybody's constitution is different, right? It took me many years to get my constitution up. I was one of those kids that was always sick, always had health issues as a child, right? Always something going on. And it took a long time. I used to get bronchitis every November, just always something going on, until the dietary change was huge and stress reduction. So people said, I have a lot of pain with endometriosis, or I have a lot of pelvic pain. Diet, your sleep, exercise, meditation, that's a must. Really calming that nervous system down. When you're in that stress mode, that fight or flight mode, your energy gets mobilized to survive.
Yeah.
So it's not going to reproduction, it's not going to heal, it's not going to digest, it's going to survive.
Mm-hmm.
And when you elicit that relaxation response, which is what you're doing when you meditate, when you bring those brain waves from high beta into alpha and theta, when you turn down that sympathetic nervous system, that fight or flight, and engage the parasympathetic nervous system, the rest and digest, you free up energy for healing.
Mm-hmm.
And that's why people walk out of our clinic saying they got the Acubuzz, right? That's the sympathetic calming down and the parasympathetic being engaged. That's the high beta brainwaves that overwhelm into alpha, detached relaxation, or theta, where real healing happens. And so I love it when people come out of there and say, I'm so buzzed, I don't think I can drive. That's a healing state. And you want to learn to elicit that every day through meditation and breath work, because if you can elicit it several times a day, you're going to create that healing response in your body. You're going to regulate your autonomic nervous system. That's why you're coming to us. We're helping you do that, but I want you to be able to do this on your own at home. So we're the catalyst. We're here to support you and teach you all these tools. So when we pull away the acupuncture, when we pull away the laser on a regular basis, when we pull away the herbs and supplements, you have these practices and these tools and these lifestyles, like the right types of diet, so you maintain your health and you continue to move towards vitality. And then you just come in for a little tune-ups. That's what we like to see. And that's our goal for you guys.
That makes complete sense. And I do want to say, you talked about your own health issues. So we talked about, treating people here that aren't looking to get pregnant. But you also treat males here as well as a range of people with different disabilities as well, right? Or illnesses or conditions.
Yeah.
So, to all my other followers as well who don't have endo, there's a broad range of treatments that the laser can also help with as well. I use it for back. I don't know if I mentioned that before, but we have done back treatments here as well for that. So there's a huge range of things, and I want to touch on that because you mentioned your own health. So talking about what this clinic offers, and it's not just for, women with endo, it's for basically anybody.
Yeah.
Yeah.
So we're famously known for fertility, so much so that people think that they can't come if they're not trying to get pregnant, but that's not the case.
Mm-hmm.
So we're just really well known internationally for our fertility. We treat, the 5 things that we see a lot of are fatigue, digestive issues, hormonal imbalances, which infertility and PMS, acne fall under, unwanted weight gain, and anxiety and feeling depressed. Those are the things that I think we see a lot of. And then the pain is very common. People know it for acupuncture. I'll share a story. This woman came with rheumatoid arthritis. She had it in her knees, her ankles, her hands, her elbows, her wrists, her shoulders. And in the hour of treatment that we had with her, I couldn't hit all the joints. And she wasn't able to walk very well. It was hard to get up and down from on her couch. And I said, I'm just going to focus on your knees. But this is okay because the laser has a systemic effect, which is really important. We're treating your endometriosis and you have shoulder pain, you're going to benefit on the shoulder pain because the laser has a systemic effect on how it regulates inflammation and what it's doing on a cellular level. And so as we treated her knees, they got better quicker. However, every joint improved. And she now runs and she now bikes. And this woman couldn't get up and down from the couch. We had somebody that was able to cancel their back surgery. Some of the nurses because we were on at the fertility hospitals, where they had like a frozen shoulder. They had such real bad shoulder from her last nursing job. And after 2 treatments, the mobility, how much she saw the range of motion.
Treated here too.
Yeah. So if you on the Acubalance site, you can see some of the patient stories. So using the laser with acupuncture, we have my massage here, so we have the whole pelvic care as well. But yeah, we see a range of things, but the fatigue, the digestive issues, the pain, hormonal imbalances, anxiety, depression is quite common. Anything to do with women's health, with men, yes, we see men for all their sport injuries, their golf injuries, but we also see them for fertility. Some men come in for stress now. Men are usually easier to treat. They just don't seek out health professionals. So
they wait till last minute.
Yeah, they come in, every question, this is the question I ask guys. You know, when people see me, I always say, what are your expectations for my treatment? Because I want to meet your expectations, so I usually ask that. When it comes to men, I say, so why are you here? And they usually say, my wife told me I had to come. They're never there for themselves.
I believe that.
That's never a good sign, right? Because you have to want to be there for yourself.
Yeah.
But yeah, we do stuff for male fertility, and we do stuff for just general men's health, and a lot of the aches and pains. You know, people come for their insomnia. And so, again, we dig for the underlying causes. It always comes back to those things that you can do: diet, lifestyle, exercise, you know, your sleep habits, meditation. Like the science is really showing how powerful and impactful this is on our health. And then our catalysts are things to support you: acupuncture, herbal medicine, naturopathy, supplements, low-level laser therapy, gua sha, cupping, mind abdominal massage, if I haven't said that already.
There's lots,
You know?
yeah.
So we have that multidisciplinary, and then we work with physicians in the city, and again, we're on site at one of the largest IVF clinics in Vancouver over at Olive Fertility. And so it's really integration because we have that professional relationship. I gave a lecture recently at one of the high schools for Career Day. I thought it was really interesting. They wanted to know about acupuncturists, and they had a question about the West versus the East. And I just said, they're two different paradigms. They're actually two different maps of the same terrain. Don't confuse the terrain for the map. And I said that they both have their strengths and weaknesses. So it's not an either or.
Right.
When you use these together, you get the best of both worlds. So that's really how I practice for my own health, for my family's health, and my patients. It's like, yeah, I love the fact that they see their doctor and we communicate with their doctor.
It's not either or, basically.
It shouldn't be. It actually, I don't think it should be. I think you're left hand behind the back, right hand. I really like the integration. I really think they both have strengths. And when you put them together, you're really getting the best of both worlds. And now you get, like, where Western medicine is so good at a micro level, going to the detail, and Chinese medicine is such a holistic, big picture, you really get two perspectives on you, and it's empowering and it's powerful.
And the reason why we wanted to talk about laser today was, one, that we had a lot of people wondering, you know, why I'm going to these laser therapies. What is it doing? Is it actually helping me? And so that was the main reason that we wanted to talk about this. But it was actually the thing that gave me the boost. You know, I was trying to do all these little things, trying to do the diet. You know, exercise was still kind of there because of my back. But I found that laser made a huge difference, along with combination of sticking to the supplements and the herbs. So that's why I wanted to share it with you guys. It's not like, this is not an ad, you know, for Acubalance. It's just something that has worked, and I think it's something that people should try, or at least give it a try. There's no harm in it. It can only help you, basically. And what I also liked about Acubalance is that, you know, like Lorne said, they offer, you know, information on diet, supplements, herbs. They have a naturopath here. There's mind massage here. So there's a lot of things you can do to help yourself, depending on what you want to try. You know, so you have that option here, basically, available. Yeah, and you have listeners in Australia, right? Right, yeah. So one of the experts that I have reached out to quite a bit is Dr. Roberta Chow. She's an MD, and she's a medical doctor. She has her PhD, I believe it's in laser therapy, and she's an acupuncturist. So I get to visit one of her clinics, and we've spoken regularly since I met her in Australia. And it was her that really inspired me to start using it more for the endometriosis. I mentioned Fred Kahn, so we were playing with that protocol. But she does a lot of laser therapy for pelvic care and endometriosis. And then she was sharing how a lot of women that she has treated with, so anecdotally, with endometriosis that also were struggling with infertility, went on to have natural pregnancies. And it was from her I got the understanding, the idea to start to work from the thoracic and the sacrum. So we were doing most of our stuff just on the front until November of 2018. Right. And then after I visited her, we started adding more to our protocol because she treats a lot of the back area because of how the nerves innervate the uterus and the ovaries. And then she's published research in the Lancet using the laser for like a neural block. And just to share with your audience, we had a patient that had to go through an egg retrieval, but because of her constitution, she wasn't able to take the fentanyl. So they had to do the
the anesthetic locally, which they always do, but you're high, so you don't care that you're getting an injection in your vagina. But in her case, she's not going to be high, so she was quite concerned because it's an uncomfortable needle.
Of course.
So we used the Lancet's protocol, and I talked to Roberta Chow, and we used the laser to create a neural block in her lower part of her body, the pelvis, and she went through she felt zero, nothing, which was great.
Yeah.
So if somebody's coming to my practice, when we use a laser, you'll notice we have an approach. We'll do stuff along the spine because we want to what's innervating that area, and then if you're in a lot of pain, we may do a certain thing along the spine to act as a neural block. And it takes about 10 minutes to kick in. It can last about 24 hours. So we'll do that. And then we're doing laser locally because we want to help with the healing of that tissue. Because if the tissue is injured, it loses blood flow, it gets choked off, so it doesn't get, the blood flow is choked off, so it lacks oxygen. You start to develop that chemical soup that's causing that pain. And so we want to move that chemical soup. We want to increase the blood back to the area. We want to increase the mitochondria function, the ATP production, so the energy production on the cellular level to accelerate that healing, that repair, and also bring down that inflammation. So we'll do stuff locally. If it's shoulder, we'll do stuff away from it a bit, and then we'll get into certain lymphatic area and along the spine. And this is what's really exciting about the laser, combining what's called PBM, Photobiomodulation theory, with the acupuncture theory, so hitting acupuncture points and just muscle tissue. And you can see some excellent results with it, and it doesn't hurt. That's what I love about it.
Exactly,
right?
yeah.
People.
So people in Australia, I think you said Roberta Chow is in Sydney?
It's in Sydney. They have a couple of clinics, and it's Roberta Chow so if you search Roberta Chow, Sydney, Australia, laser, her clinics will probably come up. Another clinician that I met while I was there, Lydia. So Lydia, because they have a couple offices. So I went to actually Lydia's office. So she does the laser. So you can check out Lydia's clinic, Roberta Chow's clinic. Roberta Chow's a clinical director for them, and brilliant physician that I'm so grateful for having these conversations on a regular basis. As I work through my fertility protocol for laser, I often ask her for feedback because she is such an expert when it comes to low-level laser therapy. So I bring my fertility knowledge and clinical experience and what I know of laser, and I keep going back and forth with her. Same thing with the group in Japan, Nakamura's clinic. I got a translator, and we talked about what he's doing, and we never met. And when he went through his protocol for laser, it is what we're doing. Pretty damn similar. We're doing a little bit more.
Yeah.
But I mean, he's doing the pudendal nerve. Like, I was just like, wow. And we had never talked to each other. And they've been doing it for 10 years.
Oh, wow.
And they got some data where they show that it increases, on average, the blastocyst rate. So getting these embryos at day 5 almost doubles for women who have done IVF that were successful. So this is what I'm doing. I'm constantly, as you know, I'm a little bit of a geek on this. I'm just talking to the experts around the world as we work on our protocol here at Acubalance. And I'm excited and happy to be able to share and let people know, like, look for people in your area that are skilled and are using low-level laser therapy, PBM. And remember, at the beginning, this once a week, if you're going for laser and they just do 30 seconds over your back, I don't know a laser that's strong enough to do 30 seconds. So you're probably not, you got laser, but you didn't get laser. Yeah. Because some people do that. After the end of the massage, the acupuncture, they wave the laser a little bit and call it laser. Not going to get benefit from that. And if you're coming once a week, you're probably not going to benefit. Eventually, you don't need to come once a week or even weekly. But at the beginning, if you're in pain or you have a health issue, you do want to plan for like 3 times a week for the first 2 to 3 weeks is reasonable. And then by then you should be feeling some shift that you can start to really spread them apart.
Of course, yeah. I think that's really important to know.
Can you mention your website again? Because it's a great resource for your listeners.
Yeah, so the website is Endo in the 604. We do have an online support group. We are meeting actually in about a week. So you can join at any time. You can also follow me at Endo in the 604. We cover various topics on there, and we talk about local resources. That was one of the hard parts of having endometriosis here, was I didn't know a lot of stuff. I didn't know where to go, who to look for. So, having like you guys, focus on endo, it's amazing. You collaborating with other people, in Australia and in Japan. I mean, that's what we need, because the endo community needs people who are focused and dedicated to this. So thank you guys for that. But if you guys need to learn a little bit more just about endometriosis, you can check out my site on Facebook, Instagram, and I'm on Twitter.
Great. Thanks a lot, Roop. This was
Thank
fun.
you very much as well.